in which she consults in business development and global partnerships for the biopharmaceutical industry. She is currently also a visiting professor here at Duke. Previously, she had led a successful 11-year career as Director of Business Development at GlaxoSmithKline. Ms. Barnes-Weise will talk to us about the fundamentals of business development and licensing for young medical startups. Please join me in welcoming Ms. Barnes-Weise.
Hello. So I spend half to two-thirds of my time teaching now, and the other half consulting. And in some ways, they're the same thing. So first of all, I can't start the normal way. I have to start as if we were a class. So how many people here have actually made an invention? Okay. And people that have invented something, how many of you filed a patent? Right. So this afternoon session, which I'm sorry is the only session that I've been in, we've kind of gone from the end result to the exit through the operating of the business. And what I'm going to talk you through very quickly today is, so you've made an invention in the biopharmaceutical area, so what next? That's pretty much the I'm going to try to talk you through in 20 minutes. Practicalities, and then the last slide is essentially going to argue that actually the market doesn't work well in a lot of ways and what some people are doing about it. So I have to give my little public service announcement to finish up. Let's see. Okay, first of all, who's ever done a license? Who's ever licensed anything? Same cast of characters. All right. Anybody want to guess what a license is, or try first before describing what it is? Anybody feeling brave today? All right. And I should tell you this, by the way, too. I'm like a walking depiction of somebody that had no idea where they would end up at this stage in their career. I started as a lawyer. I worked at SAS in the software industry, which actually, I must confess, at that point I found very boring. Now it's much more intermingled with the medical healthcare. And went to a small company that was the first GPS software company after that. Sold itself to Westinghouse, then went to GSK, or Glaxo, and Glaxo Wellcome, and then by the time it was becoming GSK, I started consulting. Consulted quite a bit in Europe and quite a bit in the US, and I'm a consultant for the WHO World Health Organization as well, and some frontier. So I've had a very mixed career. Okay, nobody wants to guess what a license is. We'll get to that in a minute then. What I tried to do here is talk you through what the key elements of business development and licensing are. And I'm not going to read all these things to you. But this is what I'm going to cover really quickly. Essentially, it's kind of understand yourself and understand your product and understand what kinds of partners you want and who they are, and then how you go through the process of contacting them and what about a license agreement that you might negotiate with them down the road. So you might laugh about the last part, but one key element is a good negotiator, and I said also a good lawyer, which may be the same thing, but may not be the same thing. So know myself. So what is licensing and what can it do? This is the kind of the non-legal description of it, and then we'll go to the legal description. But basically, it's an intellectual property right to convey at least in part to a person or entity other than the inventor. And it's also a tool to further development and commercialize your invention. So just so you have the legal definition, I had to put this in there completely from a law firm. License is a transfer of patent right. It can also be a transfer of a trademark right or a copyright or even a couple of other different versions of trade dress and utility patents in some other countries. It's essentially a right to make, use, and sell, offer for sale, or export your invention or any part of your invention in different territories or different indications. You can divide that property right up in many ways. So it's kind of like if you licensed out part of your house, you rented out part of your house to somebody else and they live there, and then you rented out your garage so somebody can park there, and then you give the rest of your house to somebody but over and only in the summer. It's a little bit like that. So you have to think about your particular invention or your potential product and who's going to help you get that commercialized best in all the markets and perhaps in all the therapeutic areas of uses. Yeah. It's basically a waiver of your right to exclude. In other words, you, by getting a license, you're saying that you're not going to enforce your patent rights or other intellectual property rights against that party. So, again, what the license do, hopefully leads to commercialization of inventions. Again, lots of commercialization potentially of another invention, your competition is out. It enables more than one invention to combine and perhaps form a combination product, and there's a lot of combination products in the pharmaceutical industry. Hopefully creates a revenue stream which somebody can get an exit from somewhere down the road, and it provides the basis for your business value in many senses. There's, as Greg pointed out, less and less medium to large biotech companies have invented their own NCEs. A lot of them are licensing. A very high percentage and growing every year come from university research and government research. Hold that thought when I get to my last slide about who's inventing things, whose money is going for the invention. All right. So I'm coming back to this. So somebody's going to have to answer me. So does it bring anything to mind when you talk about intellectual property licensing? Bad thing, good thing, a company that's an example of, looking at your iPhone, does that come, anything in there come to mind? Oh, come on. Somebody throw something out. Licensing. I told you what it was, so you might want to recognize one somewhere. You know, about 3/4 of the things in your iPhone, Apple didn't invent. They licensed in the rights to put those things in the iPhone and to sell them. And you'll find that's true of pretty much any complex technological or medical thing you use, drug you take. It's not just one person's invention often at the end of the day. So there's a lot of licensing around you. And I spend a lot of time talking to my classes about why should they care. Why should they care about licensing? And why should they care about negotiations, for instance? So anybody have any example of a successful license? Oh, come on, how about business people? Somebody give me an example of a successful license. Share with them. Really? Okay.
What is it? Doesn't pharma license drug rights to smaller biotech firms? And
Well, yeah, both ways. But what is an example of one that's made a lot of money? Let's see, I made myself a little list here. How about Virusept? Yeah? So Virusept, I believe the NC was invented by Eli Lilly. They got into a sort of a platform collaboration with the company Virusept. Let's see, I have to get this. The stream of this is quite complicated, as it often is with pharmaceutical companies. When the Lilly-Aberon collaboration broke up, Virusept, which is a drug for AIDS, was basically reverted to Aberon. Aberon was then bought by Pfizer substantially for its AIDS drug, which is now sold by Pfizer. So you can imagine the kind of stream of licenses that followed that product as it became invented and as it finally made its way to the market at the end of the day. Sorry, we have to have one more. Now, there's another kind of intellectual property that I didn't really mention, but it's trade secrets, and I'm sure at least some of you know what the example of a famous trade secret is, especially if I tell you that it can be a formula locked away in a vault somewhere. Coca-Cola. See? I knew I could get something from you. So, in order for it to be a trade secret, you have to keep it secret, right? So, if you have a partner for a trade secret, how can you share information on that trade secret and on that private information that's hidden away in the vault with a potential other partner that might need to know, for instance, how to manufacture? Anybody have an idea?
Non-disclosure agreement.
Non-disclosure agreement, and what does the non-disclosure agreement lead to?
license.
Okay. All right. So the licensing process. I'm going to get back to know yourself and your invention, because you need to know what you need to develop and eventually commercialize that invention. And so you've got to know what it does and who it might be valuable to and who might be interested in helping you reach the market. Anybody that says they have an invention, want to tell me if they managed to get that invention and that patent to the market without anyone else getting rights to that invention? Anybody? No, it's rare. It's rare. I mean, first of all, there's lots of inventions and a small percentage makes it to the market, but of the ones that make it to the market, it's very rare the original inventor is the one that actually takes it to market. So you need business relationships. You have to think what you want to achieve through the license, and that sounds simple. You know, I want to make money through the license, but for instance, if you're a small biotech company, you might want to learn how you actually work with the FDA and what the process is of going through the regulatory process, and so you want to participate in that and not just get money as the drug or vaccine goes through the process. Ideal profile of your partner. Most of the spin-off companies and the young companies I talk to, it's like they got the invention, they're really excited about it. It's hard enough to get them to sign a confidentiality agreement before they go sign and talk to another company. But they haven't really thought about what should the profile be of that company. Because, you know, plenty of people make lists about what it should be the characteristics of the person they marry, right? Surprisingly, how many people make lists of the characteristics that their partner company should have before they actually start contacting? They just start thinking of names of companies, but they don't actually think, do they have something in the pipeline that might conflict with what I want to talk to them about? So is it kind of sort of either dangerous or inappropriate to contact that company? So think about the type of companies you want to talk to. And again, we talked about what you want to achieve, what's the profile, and then you get to, so what companies actually meet that profile, right? So for steps towards a license, again, my main comment that I want you to take here is from the very first contact with other party, you are negotiating. You're marketing and you're negotiating. So you have to think about that from the very first letter you send out, summary you make, talk that you have perhaps at a scientific meeting, you're marketing, and you're negotiating because you're talking about the value of what your invention is. So it's sometimes hard to find the right person at the companies that you've set as your target companies, and there's lots of different ways to do that, depending on how early, for instance, the early stage the technology is. Because a lot of times when someone with very early stage technology comes to me, they should be talking to people in R&D or maybe somewhere in clinical, and not sending it later on to the business development people, because you want to champion in the company, and so you want to talk to perhaps those clinical or development people about whether what you've invented might actually fit in. So think about where in the company you're contacting somebody and try to really find out the names. It works a lot better than the kind of to the CEO of this company, which surprisingly a number of people write letters to do that. So you can go to scientific meetings. I'll give a little plug for LES, Licensing Executive Society. There's people that attend those meetings from almost all large and medium-sized pharmaceutical companies, so you can even look, if you spend a little money getting your student membership, you can look at the directory and at all the addresses and phone numbers. But do a little research. Right. We talked a little bit about confidential. Well, let's go back. So cover letter, non-confidential summary. Someone up there mentioned doing a confidentiality agreement first, and you should try always to do a confidentiality agreement at the beginning when you want to share some information. But sometimes the company doesn't want to sign a confidentiality agreement with you because they may have research in the same area. And that first conversation, or even that first mailing or contact, is only going to have your non-confidential summary. Again, it's your marketing piece. So you're basically telling them what you have and why it's a breakthrough or an improvement and why they should be interested in it in a non-confidential way. If you think, when you meet with them, that there's no way that you're going to be able to stay talking about non-confidential things, then make sure you have your confidentiality agreement in place before you have the meeting. So what do you want from a license or a licensee? And I'm giving you might want. What's your commercial goals? Do you want money now to bring your second learning CE along, and you don't want to take any risk of accepting milestone payments for certain things happening down the road? In which case, you're probably going to have to accept less money because you're accepting less risk. Or are you saying this is going to be best thing since aspirin, and I'm betting that it's going to be around for the full length of its patent as a blockbuster drug, and so I'm willing to take some money after it actually gets launched or goes through the clinical development process. Let's see, due diligence obligations. So if it's your firstborn, you do want the other company to agree to do certain things. You want it to agree to develop and certain steps that go through that, and you want to try to get it approved to sell in maybe just the U.S., maybe the whole world, or maybe for a particular indication. But be clear about what it is that you actually are agreeing with the other person to do, because you want to be able to come back later on and look and see did they do it, or if they didn't do it. And if they're not doing it, then you may want to terminate the license and take it back, or at least part of the license. So be clear about what the obligations of the other party do with your intellectual property. IP protection, I only mention that because it has to do with who takes charge of keeping your patents filed and renewed, and all the different translation and other costs involved in spreading them around the world. There's control and there's cost. So you might want some control over it. They might say, well, we're going to pay for all of it, therefore we get to choose how we patent it, what we patent. Yeah, and involvement. I mentioned this earlier again. Especially for a smaller startup company, you probably want to learn something. So you can put an agreement on certain things that you're involved in. Have to serve as a consultant to the company. You think that you're the expert in that particular scientific area, and you want to make sure that you stay involved and at least seem to have some input into the development of that drug or vaccine. And termination rights, I mentioned that in conjunction with due diligence obligations, but there are a number of things that you have to be clear about if the other company doesn't do them, that you have the right to terminate. You hope you don't get to that point because there's a delay, and always once you terminate an agreement and finding a new partner and moving the product along. So yeah, so you don't want to terminate if you can possibly negotiate something else. All right, this is so the basics. I must tell you that the overheads I'm showing you today are, I teach an access to medicines class, I teach a policy class around medicines and technology, and these are full-term classes, so you're getting them all squished into overhead. In any case, basics of negotiation. First thing we decide if the company is interested and wants to talk to you and has asked you to come. So let's say your three buddies, you all invented this in the lab, and you've talked to the university into letting you take charge of negotiating with potential partners. And you're trying to decide who should actually be doing that negotiation. Because two things. One, you have to decide who is really going to speak or going to guide the discussion. And have you agreed in advance how that discussion is going to go? And who at the end of the day is going to say yes or no to things that get proposed in negotiations. Otherwise, you'll find each other kicking each other under the table all the time. I've actually done it and seen happen. I've got about 3 minutes left, so introducing your company again, knowing who you are, what the advantage of both your company, if you're going to be involved in it, or your product, description of the product, technology again, what's its competitive advantage, what's its IP status, and what's the value from that. Let's see. Let's move on here. I am going to let you all read those later if you get a copy of these. These are only the main terms in a license agreement. License agreements often take, from the time you first meet a company in the biopharma industry, a year before you actually finalize that agreement. So don't run out of money or enthusiasm halfway through the process. Plan that probably it's going to take a year. All right, I have to say this. So there are many cases in which the market doesn't work well. I'm going to just use one example, antibiotics. There has been one new antibiotic invented in the last 17 years. There's a huge problem in antibiotic resistance. Most companies don't want to develop them because if you can imagine, antibiotics are a short term of administration. And they're a diminishing return. More and more people become resistant to those antibiotics. So there's a lot of new structures around trying to get developments in the antibiotic sphere outside of traditional pharma development, so that the governments can actually pay, so that international health organizations can actually pay to have these done, and so that they can actually control the release and use of those antibiotics at the end of the day. So that's only one example. Anybody here a member of the, I always get this wrong, Universities Allied for Essential Medicines? Okay, I'll let you go look that one up. There's plenty of places in the world where they probably can get better access to medicines in a lot of ways, and they don't have them, and I'm happy to answer many questions about that because I'm working on that in the infectious disease space. Had a big symposium last Friday on Ebola and Zika and the alliances that were formed to bring vaccines forward, and now I'm stopping.